Good afternoon, everyone. Good afternoon, everyone. Welcome. My name is David Borsheimer from the clinical cardiology section here at Montefiore, and we're very lucky today to have our friend and colleague, Dr. Rob Ostfeld, Director of Preventive Cardiology here at Montefiore, Professor of Medicine in the Albert Einstein College of Medicine, presenting on the topic erectile dysfunction and a plant-based diet, the long and the short of it. We're actually very fortunate to have Dr. Ostfeld, as Dr. Ostfeld, as you may know. Dr. Ostfeld has recently become a threat to the Kardashians. His podcast on the ACC, I think, has been downloaded, 13,000 times in the last few months. So I understand that the Kardashians are really fading from the social media platform. And here in New York this week, it's the first week in November. It's been a very auspicious week, as many of you may know. We have a new mayor in New York, Eric Adams. What many of you may not know is that Eric Adams actually published a book on how the plant-based diet saved his life. So one of the things that will actually is way down at the bottom of his platform is on the subways now, with a Metro card, you'll get some broccoli. So with that introduction, Dr. Ostfeld, take it away.
Dr. Borsheimer, thank you so much for that very generous introduction. And we definitely do try to keep up with the Kardashians. We are probably 4 or 5 orders of magnitude at a minimum behind them, but we aspire. So thank you very much. And it's a real honor to be here with you all today. And it's very exciting news from a nutrition perspective in regard to the mayor-elect of New York City, because it is a great focus and priority of his. So it should be interesting to see what things unfold with his mayorship. So we are going to be talking about erectile function and a plant-based diet, the long and short of it. And we had started a cardiac wellness program here, 10, 12 years ago, with the goal of preventing disease with lifestyle change. And of course, emphasizing lifestyle change in addition to medications, procedures as needed. And we would encourage our patients to adopt as much of a plant-based diet as could fit for them. And so over the years, I began to notice, it's more like anecdotal reports, that men would tell me after they started living this way that they really noticed that their erectile function had improved. So I started to become, more and more interested in the topic. It was sort of a nice side effect for these patients. And one patient actually told me that he is now a rock star in the bedroom. I don't know what his wife thinks, but that's what he thinks. So erectile function in a plant-based diet. So of course, the choice is yours in terms of what kind of dietary pattern you wish to have. And this is, of course, the path that we have noticed patients deriving meaningful benefits from in regard to cardiovascular disease and actually anecdotally erectile function as well. So what is the definition of erectile dysfunction? It's basically the inability to achieve an erection or maintain an erection satisfactory for sexual performance. And we had the opportunity to write a review article that some of this information is taken from, published in just recently, American Journal of Medicine. Now you can get much more specific in regard to nailing down the diagnosis of erectile function. And there's the IIEF score, the International Index of Erectile Function 5 questionnaire, which is a validated questionnaire in regard to diagnosing erectile dysfunction, and just mild, moderate, and severe. And you can see there are 5 questions, and you can get scores anywhere ranging from 1 to 5, higher being better. For example, over the past 6 months, how do you rate your confidence that you could get and keep an erection? Very low, low, moderate, high, and very high. 5 such questions. Scores can range from 5 to 25. Normal erectile function is a score between 22 and 25. So how does one get an erection? It's obviously a complicated physiologic interplay between the hormonal system, the neurologic system, the vascular system, and in general, there's some kind of stimulation, whether it be physical or psychological, and with that, nitric oxide is released, relaxing smooth muscles, allowing more blood flow into the penis. And that blood will then also begin to pool in the vascular lacunae, or the venous lacunae in the corpus cavernosum, engorging it, and eventually it'll engorge enough so that it hits up against the tunica albuginea. I'm sure I'm pronouncing that incorrectly, my apologies. And when it gets pushed up against that, that can limit venous outflow, causing the erection. So that's how one gets an erection. But what causes erectile dysfunction? Organic is, these are categories that are used. Organic is the most common, and there are a number of different reasons for it. There's vascular, neurogenic, hormonal, drug-induced, beta blockers, SSRIs can do it. But vascular is the most common of the most common category, organic. There's psychogenic, depression, anxiety can do it, and there are mixed causes. But vascular is the one that we'll focus primarily on. So the epidemiology of erectile dysfunction in the Massachusetts male aging study, it's been described that about 15% of men between 40 and 59 years of age have erectile dysfunction, 45% in their 60s, 70% in their 70s. To be honest, I think this is an underestimation, particularly in the younger age ranges. And although I can't unequivocally prove that, the reason that I think it's an underestimation is, of course, this is somewhat of an older study, and obviously our cardiometabolic health has not really gotten better over the last 20 years or so. But also, just as anecdotally, conversations with urologists and my own clinical experience, it does seem like it's higher than that in our patients. But that is, of course, anecdotal. And erectile dysfunction is considered the canary in the coal mine for cardiovascular disease. And it typically, erectile dysfunction of a vascular type happens maybe 2 or 3 years before angina, and about 3 to 5 years between overt cardiovascular events. And of course, atherosclerosis is a systemic disease. So why do we call it the canary in the coal mine? Of course, it heralds these issues, but the artery to the penis is smaller than the artery to the heart, coronary arteries. So by the time you have an atherosclerotic blockage in the artery to the penis that may be causing erectile dysfunction, it's exquisitely likely that you also have coronary atherosclerosis that has yet to overtly manifest. So hence the sort of the pathophysiologic hand-waving rationale behind the canary in the coal mine phrase, underpinned by the epidemiologic observation. So a little bit about pathophysiology. So these are coronary arteries, but as you know, the endothelial, there's the single endothelial layer lines the inner wall of the blood vessel, kind of like wallpaper, and we want to keep that as healthy as possible, obviously. And the endothelial cells can secrete nitric oxide, it can dilate, but over time they may become injured or damaged, whether it's from inflammation, perhaps a toxic Western diet, smoking. And when that happens, those endothelial cells may not secrete nitric oxide as well. And also cholesterol particles can then burrow across the endothelial cell much more easily into the wall of the artery, where they then may become oxidized and become irritating to the wall of the blood vessel, kind of like a splinter, creating more inflammation, more atherosclerosis, recruiting in more cells, and the process can continue and a plaque can develop. And one day the cap overlying the plaque may rupture. This is for coronary atherosclerosis, and of course cause a non-ST elevation or ST elevation myocardial infarction. But this is a simplification of the pathophysiologic mechanism behind which an atherosclerotic plaque can develop and grow. So we talked a little bit, some more about the epidemiology of erectile dysfunction. And in a prospective cohort study of about 1,900 patients aged 40 to 70 years, along the lines of the canary in the coal mine, erectile dysfunction was associated with 40% greater hazard of mortality versus none. So again, a marker perhaps of vascular risk. We talked a bit about what causes erectile dysfunction. We're going to focus on the vascular one. So what might cause vasculogenic erectile dysfunction? Of course, the atherosclerotic plaque, which can be brought upon us by various cardiovascular risk factors. And if you look at comparative relative risk of erectile dysfunction from the major vascular risk factors, sounds just like any patient we may describe presenting with a cardiac issue, a coronary artery disease issue. So diabetes. So the odds ratio in a cross-sectional study of about 3,500 people, they have a 2.69 greater odds of having erectile dysfunction if they have diabetes. Other studies are, directionally consistent in a review of 145 studies. I can't see this number because of the little box with over 88,000 patients. There is a significantly higher odds ratio of having erectile dysfunction. And for every 1% increase in hemoglobin A1C in this smaller cross-sectional study was also associated with a higher odds of erectile dysfunction. Of course, this would appear to be a dose-response relationship. Hyperlipidemia, something we also, of course, discuss often in our coronary artery disease patients. In a prospective cohort of about 3,200 people, having a total cholesterol more than 240 versus less than 180 was associated with higher odds of erectile dysfunction, and there's also a dose response apparent relationship with each millimole increase in total cholesterol raising the odds of developing erectile dysfunction. Obesity, and in cross-sectional data, body mass index more than 30 versus less than 30 is 77% higher odds of having erectile dysfunction. Also similar theme in regard to waist circumference. Hypertension, another one we talk about all the time, cross-sectional analysis of 56% higher odds. Inflammation, another important theme in coronary artery disease, vascular risk, higher levels of inflammation versus lower, associated with a 50% higher odds of having erectile dysfunction in cross-sectional data. Tobacco use, not surprisingly, also associated with more erectile dysfunction, as was cigar smoking as well. So diabetes, of course, we just mentioned that on the prior slides. And in the Adventists, so how might a plant-based diet or healthier diet weave into these risk factors, which we would hope would be helpful overall and hope would be helpful for erectile function? So the Adventist health study is, they looked at Seventh-day Adventists, the religious group, and they have a variety of healthy lifestyles. And even those who among that religious group who eat a Western style diet typically eat a more healthful Western diet than the typical Westerner. And so this is a cross-sectional analysis to percent with diabetes, a cross-sectional analysis of about 60,000 people. And you can see they have a bunch of different dietary types. And the non-vegetarians had the highest percentage numerically of diabetes, and the vegans had the lowest. So this is an interesting analysis of a plant-based dietary pattern and incident type 2 diabetes in the US men and women, combining 3 prospective cohort studies. I believe the Nurses' Health Study, the Nurses' Health Study 2, and the Health Professional Follow-Up Study, with about 4 million person years of follow-up. And of course, if you follow me for 1 year in a study, that's 1 person year of follow-up. And so looking at deciles of a healthful plant-based diet, you had a 34% lower hazard of developing diabetes if you're in the highest versus lowest decile of a healthful plant-based diet. And in an unhealthful plant-based diet, meaning sugar cookies, the healthful plant-based diet, meaning kind of kale, the unhealthful plant-based diet had a higher hazard of developing diabetes. So perhaps helpful for diabetes, perhaps helpful for coronary risk, perhaps helpful for erectile function. Changes in plant-based diet index and subsequent risk of type 2 diabetes in women and men from 3 prospective cohorts. So this is too late to change, really. This had about 3 million person years. So each 10% increase in a healthy plant-based diet over 4 years was associated with a 9% lower risk of incident diabetes. And in another analysis of the Seventh-day Adventists, this in about 8,000 people, at least weekly intake of animal protein versus none was associated with a 74% higher odds of having diabetes. And in the Rotterdam study, with about 6,700 people with about 7 years of follow-up, increasing plant-based diet in a dose-dependent manner is associated with less incident diabetes. So important ways that we can hopefully address this risk factor for erectile dysfunction. And in an interesting small randomized controlled trial by Dr. Barnard's group with 99 people for 22 weeks, they took people with type 2 diabetes and randomized them to a plant-based diet versus the American Diabetes Association diet. And those in the plant-based diet, they lost more weight, their LDL cholesterol fell more. And for those who did not have their medications changed, hemoglobin A1C fell more on the plant-based diet. But overall, there was just a numeric reduction because a number of patients in the plant-based arm had their medications reduced, came off because their sugars were falling. So another question is, well, what about fresh fruit? That's something that comes up a lot with patients with diabetes. This is a wonderful analysis from Dr. Du, and it's adjusted hazard ratios for incident diabetes and all-cause mortality among those with diabetes at baseline by fresh fruit consumption. So they asked, is eating more fresh fruit good? Is it bad? Well, in this analysis, it turns out it's good. This is about 480,000 people with more fresh fruit consumption is associated with a lower hazard of incident diabetes. And interestingly, they had about 30,000 people in this cohort that had diabetes at baseline. What if they ate more fresh fruit? Is it good? Is it bad? Turns out it was good. More fresh fruit associated with lower mortality and also is associated with fewer complications from diabetes, outside of mortality, of course. So cholesterol, okay, so diabetes is an issue, cholesterol. Direct comparison of a dietary portfolio of cholesterol-lowering foods with a statin in hypercholesterolemic patients. And this portfolio diet is a high-fiber plant-based diet. So, and they had just small, 34 patients, 4 weeks treatments in random order. And if you were in the control arm, just basically, please eat more healthfully, the cholesterol fell about 8%. The statin arm, which was, I believe, lovastatin, 20 milligrams, fell about 33%. You can see the dietary portfolio fell about the same. So pretty impressive. And in a larger, similar study of the portfolio diet, effects of a dietary portfolio of cholesterol-lowering foods given at 2 levels of intensity of dietary advice on serum lipids and hyperlipidemia, a randomized controlled trial, one of 3 arms. And so for those who had intensive advice, like lots of meeting with counselors and physicians and RDs and stuff, their cholesterol fell about 26 points. For those who just had routine, much less frequent visits with the visit with a physician, RD, et cetera, fell 24 points, and the control arm fell 8. So that's pretty impressive. That doesn't have to be super intense patient counseling, at least in this study, for there to be meaningful cholesterol lowering. And this very interesting study out of Korea, the association of different types of plant-based diets and risk of dyslipidemia. It's a prospective cohort, and they define dyslipidemia broadly here. But in 4,500 patients, 14 years of follow-up, the highest quintile of a healthy plant-based diet was associated with a 37% lower hazard of developing diabetes, but an unhealthy plant-based diet, meaning sugar cookies, a 48% higher incidence of developing dyslipidemia. So the plant-based diet, of course, improves a variety of risk factors. We talked about diabetes just before, also associated with more erectile dysfunction, cholesterol, also associated with more LV dysfunction or erectile dysfunction. And LDL cholesterol, when it becomes oxidized, may be more atherogenic in the arterial wall. And interestingly, LDL particles of vegetarians versus omnivores were more difficult in this small analysis to become oxidized. So somehow that may be protective against oxidizing LDL particles. CRP, of course, associated with multiple issues, including more coronary disease. And in the prior graphs, we saw more inflammation is associated with more erectile dysfunction. Well, what might a plant-based diet do for that? Interestingly, in a small randomized controlled trial of about 100 patients for 8 weeks, the EVADE-CAD study, patients with stable coronary disease out of NYU, they randomized people to the American Heart Association diet or a plant-based diet, and the plant-based diet lowered CRP significantly more. High blood pressure, of course, associated with all sorts of issues, including erectile dysfunction, we know, of course, the randomized controlled dietary approach to stop hypertension, or DASH trials, the DASH arm versus a more typical Western diet significantly lowers blood pressure. The DASH diet itself is more of a vegetarian style diet, lots of vegetables, fruits, whole grains, but also does have a small amount of animal products in it. And variety of prospective cohorts show that eating more plant-based nutrition, higher quintiles or deciles, is associated with lower blood pressure. So perhaps this eating more plant-based foods could be helpful for diabetes, could be helpful for high cholesterol, could be helpful for inflammation, could be helpful for blood pressure, all things associated with a variety of medical complications, including erectile dysfunction. Obesity, another issue with associated with erectile dysfunction. And this is another cross-sectional analysis of the Adherence health study. Again, about 60,000 people. And those, the only group with a normal BMI less than 25 were vegans. This is a comparative effectiveness of plant-based diets for weight loss, a randomized controlled trial of 5 different diets. A small study, but very interesting. 6-month randomized controlled diet pitting vegan, vegetarian, pesco-vegetarian, semi-vegetarian, and omnivorous diets against each other. And in this small study, the vegans, they lost about 7.5% of their weight after the 6 months, and significantly more weight than the pesco-vegetarians, semi-vegetarians, and omnivorous ones, but not the vegetarians, not significantly greater weight loss. So the Inner Heart study, of course, is a fascinating study which highlighted the various risk factors for myocardial infarction internationally. And they found that about 90% of the risk for myocardial infarction can be accounted for by the following 9 risk factors. Abdominal obesity overlaps with erectile dysfunction. Abnormal lipids overlaps with erectile dysfunction. Smoking overlaps with erectile dysfunction. Hypertension, same thing. Diabetes, same thing. Psychosocial factors, same thing. Consumption of fruits and vegetables, possibly. Alcohol, and regular physical activity, as we'll discuss, very important for erectile dysfunction. So the Venn diagram is basically almost completely overlapped. So in terms of the evaluation of erectile dysfunction, what I'll typically do in clinic, and I weave in my urologic colleagues very frequently because they're far more expert in this than I will ask patients about it, or they will bring it up, and of course we'll take a detailed history. There are a variety of things that can cause erectile dysfunction outside of vascular risk. We'll ask about psychosocial things, neurologic issues. But the typical workup that I'll do is I'll review their medications. Maybe they're on a beta blocker that may be not completely important. Maybe they're on an SSRI that would work with their psychiatrist, might be able to be modified. But I will typically check a testosterone level, thyroid function, and will work to modify their diets, and also use a medication like sildenafil or something like that in the appropriate setting. And when things start to get more complicated, I will very frequently weave in my urologic colleagues. Patients will, so how do we address the various modifiable risk factors? So weight loss, and how does that impact erectile function? This is the effect of lifestyle changes on erectile dysfunction in obese men, a randomized controlled trial. And Dr. Esposito has done a lot of work in this area. This is a relatively small randomized controlled trial of men. It went on for about 2 years, and they had erectile dysfunction as measured by the IIEF score. So one group received detailed instruction regarding diet and exercise to lose about 10% of their weight versus just general health information. And the detailed group lost significantly more weight. And the IIEF score, erectile function score, improved in the intervention group from about 14 to 17, but remained stable in the control group. So effect of intensive lifestyle changes in erectile dysfunction in men. About 200 men with or at risk for erectile dysfunction were randomized to 2 years to 1, weight reduction of more than 5%, increased monounsaturated fat consumption to about more than 10% of their diet of calories, increased fiber, decreased saturated fat, and encouraged to exercise versus general guidance. Normal erectile function increased from 34% to 56% in the intervention arm versus from 36 to 38% in the control arm. So two small randomized studies supporting lifestyle change, improving erectile function. This is effective weight loss on erectile function in older men with type 2 diabetes, 300 overweight or obese men with erectile dysfunction, intensive lifestyle change versus general advice. And in 1 year, the intervention group lost significantly more weight and had a small but significant increase in the erectile function score versus the control group, which had no significant improvement. So there seems to be a story developing that means lifestyle change can also help erectile function. What about a Mediterranean-style dietary pattern, which is in its traditional form very plant-based, of course, with some fish, with some poultry, minimally processed or smartly processed foods. So Mediterranean diet improves erectile function in subjects with metabolic syndrome. This is 65 subjects with erectile dysfunction, Mediterranean style diet versus a control, a more typical Western diet. And after 2 years, 13 men in the Mediterranean group and 2 in the control group reported normal erectile function based on IAF score. And endothelial function and inflammatory markers, CRP, were improved in the intervention group, giving us pathophysiologic rationale to support this finding, but unchanged in the control group. In a cross-sectional analysis of about 700 men in the Icaria study, was recently presented as an abstract, and long-term adherence to a Mediterranean diet was associated with improved sexual function as measured by the IAF score. This is the abstract reference here. Now, this is an interesting breakdown of nutritional aspects of a plant-based diet, a Mediterranean-style diet, and a low-carb diet. This is per 500 calories. And the plant-based diet is equal parts tomatoes, spinach, lima bean, peas, and potatoes. The Mediterranean-style diet is 40% of the plant-based diet, plus a half a piece of skinless chicken, 1 teaspoon of olive oil, and 1 cup of 1% milk. And the lower carbohydrate pattern is equal parts beef, pork, chicken, and whole milk. So cholesterol, you don't need to eat any. Your body makes all you need. How about protein? Oh my God, my muscles are going to go away. And in fact, actually, the world's strongest man, Patrick Baboumian, is plant-based. And the reason I know he's the world's strongest man is because he won the world's strongest man contest. Beta carotene, it's subtle dietary fiber. Your constipation will go away. So the plant-based or Mediterranean arms certainly stack up relatively favorably. So how about the impact of specific foods on erectile function? We talked about lifestyle change. We talked about a Mediterranean-style dietary pattern. What about some specific foods? How about pistachio nuts? In this analysis, pistachio nuts improves erectile function parameters and serum lipid profiles in patients with erectile dysfunction. It's an uncontrolled small trial, so red flags, uncontrolled small trial of 17 men with erectile dysfunction, and 100 grams of pistachio nuts a week compared to a standard diet for 3 weeks. And there were significant improvements in erectile, so 100 grams of pistachio nuts were added to a standard diet for 3 weeks. And significant improvements in erectile function were seen. But in a more rigorous randomized trial, effects of nut consumption on erectile function and sexual function in healthy men, this is a secondary outcome of the Ferdy Nuts study, a randomized controlled trial with 83 men with erectile dysfunction for 14 weeks. A Western diet with 60 grams of nuts per day versus a Western diet with avoidance of nuts, no change in erectile function. So doesn't seem like that's going to do a lot, the nuts. What about pomegranate juice? The efficacy and safety of pomegranate juice on improvement of erectile dysfunction in men with mild to moderate erectile dysfunction. It's a randomized placebo-controlled double-blind crossover study. 53 men. Pomegranate juice was associated with the trend toward improvement in erectile activity as measured by a different kind of questionnaire, but no trend was seen by the IIEF score. So these two, the nuts and the pomegranate juice, are suggesting that more broader lifestyle change is not surprisingly more likely to be helpful. How about observational data in regard to erectile dysfunction? Dietary flavonoid intake and incident of erectile dysfunction. So this is a prospective cohort with 25,000 men. Highest quintile of fruit intake, hence more dietary flavonoids, had a 14% lower risk of incident erectile dysfunction over 10 years. Erectile dysfunction and fruit and vegetable consumption among diabetic Canadian men. A cross-sectional analysis of 1,500 men 26 reported symptoms or diagnosis of ED. Each daily serving of fruit and vegetables, as measured by a food frequency questionnaire, associated with a 10% decrease in the odds of self-reported erectile dysfunction. Of course, fruits are wholly consistent with a Mediterranean-style dietary pattern. Association between comorbidity and erectile dysfunction in patients with diabetes. This is about 300 Iranian men with diabetes. Consuming fruits seldom or weekly was associated with a significantly higher odds for erectile dysfunction versus daily. Erectile dysfunction and cardiovascular risk in a Mediterranean diet cohort. 440 Spanish men, many with erectile dysfunction. Consumption of tree nuts 2 or more times per week and consumption of vegetables 1 or more times per week was associated with the lower odds of erectile dysfunction as assessed by the IIEF score. And this is an interesting dietary factors in erectile dysfunction study. 100 men with ED and 100 matched controlled, higher intakes of fiber and nuts and vegetables and higher monounsaturated fat to saturated fat ratio associated with a lower risk of erectile dysfunction. These are things that are wholly consistent with a Mediterranean style dietary pattern. How about supplements? There's really not a lot of data, and the American Urologic Association doesn't, so to my knowledge, unless something has changed, does not recommend specific supplements for erectile dysfunction. There's studies going on, but the data now is very small, not super rigorous studies. So we are not currently recommending supplements for erectile dysfunction. Well, okay. It does appear, though, that consuming more plant-based foods under the umbrella of a Mediterranean-style dietary pattern might be helpful. Why might that be? A variety of mechanisms, of course. It may have some anti-inflammatory effect. Eating less red meat will expose you to less heme iron, which can be pro-oxidant, pro-inflammatory. Consuming less red meat can expose you to less of the sialic acid Nu5-GC, which can be pro-inflammatory and be expressed on cell membranes after consumption. Eating more high fiber foods may favorably impact the microbiome, leading to healthful short-chain fatty acid consumption and improvements in inflammation and diabetes, may lower LDL cholesterol, and in general, plant-based foods have approximately 64 times more antioxidants than do animal-based foods. So all of these things may be relevant. Exercise, yes, indeed, exercise is highly recommended in general, but of course also for erectile dysfunction, also supported by the American Urologic Association. Now, the one caveat with exercise is with a bike, because if the bike seat isn't appropriately formed, it can push on the pudendal nerve and pudendal artery and cause injury that way. So it's important when you're riding a bike to be sure it has that divot and to make sure you're not getting symptoms of numbness in the area, because that could be a sign of the bike seat causing injury in and of itself. Smoking cessation, of course, that is important for multiple things, including erectile dysfunction. So erectile function can be improved by a healthful dietary pattern, weight loss, exercise, and stopping smoking. A healthier lifestyle may increase nitric oxide synthesis and reduce reactive oxygen species formation, thereby improving erectile function. Improving erectile function with lifestyle change may also reduce the risk of future atherosclerotic cardiovascular events. Limited data on supplements. Erectile function can be worsened by diabetes, obesity, hypertension, inflammation, and smoking. It's very common and impacted by lifestyle, and it is indeed the canary in the coal mine for cardiovascular disease. Now, on a societal level, how are we doing with, we'll focus here on healthier eating. Now, this is a wonderful article published in the Journal of the American Heart Association earlier this year, and they tried to estimate the prevalence or the levels of Life Simple 7 and how impacting them might change future cardiac risk. So the American Heart Association made Life Simple 7 things that they want to optimize to lower future cardiac risk: smoking, body mass index, physical activity, healthy diet, cholesterol, blood pressure, hemoglobin, A1C. And in this analysis, we'll focus on the diet score here for now. They put people into an ideal, intermediate, or poor diet. And then an ideal diet was defined of having at least 4 or 5 of the following components: fatty fish consumption a couple of times a week, about 4.5 or more servings of fruits and vegetables a day, 2 or 3 servings of whole grains each day, I believe, low salt intake and low sugar sweetened beverage intake. And if you were ideal, you had 4 to 5 components. And they validated this to get the estimates of how often people were in these different categories in the NHANES database of about 11,000 representative Americans. So how many were ideal? 0.7% of the US population was eating an ideal dietary pattern. 0.7, these are adults, 0.7%. So people may argue about which dietary pattern may be most ideal. We are not within 10 miles of that, and every little bit matters. So 0.7%, that's concerning, and poor 0 to 1 component, about 75% of the US population. So that's really not optimal. And overall, total cardiovascular health for all of these 7, if you were ideally, you'd have 2 points, intermediate 1, poor 0, so you can have up to 14 points. And high cardiovascular health here, 12 to 14%, only 7% of the US population had that low, 59%, about 59%. So we have a lot of work to do. It's on all of our shoulders, policymakers, et cetera. And then interestingly, this analysis, they asked if people got to the ideal level, would that or would that not impact future cardiovascular risk over the next year? So just focusing on diet score, if everybody developed the ideal, everybody consumed the ideal diet, that would lower future cardiovascular events by a little over 40% over the next year. So it's super impressive. And we have a long way to go. Along those lines, Conjoint Association of Adherence to Physical Activity and Dietary Guidelines with Cardiometabolic Health. This looks at the metabolic syndrome, but you can see abdominal obesity, obesity associated with erectile dysfunction, insulin resistance / diabetes associated with erectile dysfunction, dyslipidemia, high blood pressure. All of these things are woven together, of course. There's not one diet for erectile dysfunction, one diet for heart disease, one diet for diabetes. There really is an overall healthful dietary pattern. And in this analysis, with over 2,300 patients, adherence to the 2018 physical activity guidelines, you had a 34% lower hazard of developing metabolic syndrome. If you adhered to the 2015 dietary guidelines for America diet, a 32% lower hazard. And if you adhered to both physical activity and dietary guidelines, you had a 65% lower hazard of developing metabolic syndrome. And of course, that's wholly consistent with the recommendations for erectile dysfunction, exercise, and eating a more healthful diet. And when we talk about whole grain consumption, eating more of a Mediterranean style dietary pattern or a plant-based dietary pattern, which is of course also supported by the American College of Cardiology guidelines, and also wholly consistent with the Mediterranean style dietary pattern, we're talking about smartly or minimally processed foods, because this is a very interesting analysis by Dr. Satija, where they looked at, had about 4.8 million person years of follow-up from the prospective cohorts, the Nurses Health Study, Nurses Health Study 2, and Health Professional Follow-Up Study. So they asked, if you ate a plant-based diet right here, was it better or not better for coronary heart disease risk? Well, the more plant-based diet you ate, the better you did. But the devil's in the details. You could eat plant-based and eat sugar cookies all day, or you could eat kale all day. Like, both of them are plant-based. So there's got to be a difference, right? Well, that's what they addressed. And so here, this red line's a healthy plant-based diet. The more of that you ate, the better you did. And this hatched line here is an unhealthy plant-based diet, the sugar cookies. Well, the more of that you ate, the worse you did. So the devil's in the details. And if you look here, this is the healthy plant-based diet. So the more you did of that, the better you did. The less healthy plant-based diet here, the more you ate of that, the worse you did. But this, the red line, that's animal foods. An unhealthy plant, although you did worse, the more animal foods you ate in this cohort compared to an unhealthy plant-based diet, you did a little bit better. So the devil is indeed in the details, but we don't have to have perfection be the enemy of good. In this very interesting analysis by Dr. Song, published in JAMA Internal Medicine in 2016, where with about 130,000 people, 3.5 million years of follow-up, they asked if you replace just 3% of your calories from animal protein with plant-based protein, 3% of calories from plant-based protein, is it good? Is it not good? Well, in this analysis, it's good. In this analysis, if you replace just 3% of your calories from processed red meat with 3% of calories from plant-based protein, that's associated with 34% lower hazard of death. Unprocessed meat, 12%. Poultry in this analysis, 6%. Fish in this analysis, 6%. Eggs in this analysis, 19 dairy in this analysis, 6%. So we don't have to have perfection be the enemy of good, but every step in that direction is good. Erectile dysfunction is common. And it is, something people don't necessarily like to talk about. So, it can be helpful for us, of course, to talk about it in a very, non-judgmental medical way with our patients, as of course I know all of us are doing. It is the canary in the coal mine for cardiovascular risk, as we discussed. Clearly, there's overlapping risk factors with cardiovascular disease in regard to vasculogenic erectile dysfunction. Lifestyle changes improve both cardiovascular disease risk and erectile function. And potential improvements in erectile function may prove uniquely motivating for patients to help them adopt a healthier lifestyle. So it's really an arrow in our quiver to help patients adopt a healthier lifestyle. And of course, it's all the above to protect patients, medications, procedures, and a healthy lifestyle. So it's a nice arrow in our quiver to help us do that. And this is a wonderful quote by Dr. Kim Williams, the past president of the American College of Cardiology. He recommends a plant-based diet because I know it's going to lower their blood pressure, improve their insulin sensitivity, and decrease their cholesterol. This is a little bit of information about our cardiac wellness program. And I did want to highlight, and I thank Dr. Vorsheimer for mentioning this earlier, we developed a podcast called Cardio Nutrition with the American College of Cardiology that had a 3-month run. It just finished. And it's about 15 interviews about guidelines, about different dietary patterns, keto, intermittent fasting, plant-based, Mediterranean, a variety of other topics. They're all pretty bite-sized, mostly 10 to 20 minutes, but most around 12 minutes long. And this is the website at the ACC where you could download and listen to them or get them wherever you get your podcast. So thank you very much. It's a real honor to be here with you today. And hopefully this will be something that we can use to help our patients adopt healthier lifestyles.
Okay. If anyone has any questions, they can feel free to submit them into the chat. While that's waiting, like we said, there's no CME for the moment. Rob, let me ask you 2 quick questions, if you have a second.
Sure.
So obviously there's a plethora of reasons across the spectrum of pathophysiology why a plant-based diet would improve vascular contributions and endothelial particular function related to erectile dysfunction. But if you look sort of in the urology world, and they approach erectile dysfunction more 10,000 foot, and an important part of what they do when they evaluate patients is measure testosterone levels. Do you have any data about the impact of a plant-based diet on testosterone levels?
I don't have a lot of data on that. We certainly check for it. Anecdotally, I am not aware of any negative impact of a plant-based diet on testosterone levels.
Right, I was looking at the opposite, of favorable effect.
It may very well, but that's a great question. I don't have the data on that. Anecdotally, which I've checked a few patients, no issue. And I've spoken with a number of urologists about it. And also they see no issue in regard to that. And like you said, it may be actually helpful for testosterone.
Let me just take one more look at the chat and see. And then I have one other question for you. So back to sort of the conversation with the patient, obviously, as you mentioned a moment ago, the potential benefits of a plant-based diet on a spectrum of cardiovascular outcomes obviously should be enough to motivate a patient, but the additional motivation for a male patient to embrace this could be the impact on erectile dysfunction. So do you have a sense for how long it would take before a patient would see an improvement? So
it's hard.
Go ahead.
It's hard to know exactly. And actually, interestingly, we are hopefully in the next couple of months going to be launching a randomized controlled trial looking at the impact of dietary pattern on erectile function in young, healthy men without erectile dysfunction. And we're only going to be giving them 4 meals worth of food. And our hypothesis is that a plant-based diet will improve it more so than an animal-based diet. but we're only giving them 4 days worth of food. And we base that on, in part, there's wonderful work on flow-mediated dilation where you have one unhealthy meal and you have negative endothelial function for 6 or so hours. So the hypothesis is with the normal erectile function, even 1 or 2 meals may be able to improve that. And there is, anecdotal stories about that. But in terms of if someone has overt erectile dysfunction, I'd fall back in part on those studies that went out like 1 to 2 years, those randomized trials we discussed. Anecdotally, in my experience in patients, and some of them just bring it up on their own, I will typically hear about it within 3 to 8 months after they start the healthier dietary pattern.
I mean, for what it's worth, pathophysiologically, that makes sense because 25 years ago, using lovastatin, which had a modest impact on cholesterol land schools, I think showed with a PET study that you could improve PET ischemia in 3 months. And lovastatin doesn't really work. I'm sure that a plant-based diet probably comparable, 20-point reduction in LDL is probably comparable to what Mevacor could achieve.
Yeah, in the dietary portfolio study by Jenkins, they had a low dose of lovastatin lowered LDL cholesterol about the same as a plant-based diet. And also, the plant-based diet is going to, of course, as you know, have benefits far outside of cholesterol, anti-inflammatory, antioxidant, blood pressure. So it's likely, the cholesterol is just one pillar of the many pillars of benefit of a healthful dietary pattern. And I believe there were some studies by Ornish, but I don't know the time frame, where they took people, and I think Dr. Alexander Leaf was the senior author on these, where they took people with positive PET scans and over a number of months of a healthier lifestyle, those PET scans significantly improved with blood flow. So, but that I don't have the time frame exactly off the top of my head for that study.
Okay, well, if there are no further questions, and I don't see any in the chat, thanks, Rob, for an educational lecture, and we'll see you all next time.